Welcome to your training session for herniated discs. Exercise 1. Massaging the hip flexors. For the first exercise, you will need a BLACKROLL ball that is 12 centimeters in diameter. Lie down on your stomach. Place the ball above your groin between the top of your hip bone and your straight abdominal muscles. Support yourself loosely with your arms. Let yourself sink down slowly onto the ball. With each breath, you can sink a little deeper into the ball. Relax here for about 1 minute. Be careful while doing this exercise. You shouldn't feel a throbbing in your abdomen. If you do, change positions. Concentrate on breathing from your abdomen. Work on the other hip flexor by placing the ball on the other side. Let yourself sink down onto the ball again. You can get even deeper into the tissue through your breathing. Don't be surprised that you'll be working on the front side of your body first. This is important in order to reduce any tension from the shortened muscles and fascia caused by everyday life, especially from sitting a lot. Take calm, deep breaths and relax. This exercise is highly recommended, especially after long hours of working in front of the computer. Slowly come out of that position by pushing yourself up using your forearms. Exercise 2. Massaging the gluteal muscles. You need the BLACKROLL ball 12 again for this exercise. Place the fascia ball on the floor and sit on it with your right buttock. If possible, place your right leg on your left thigh. Move slowly on the spot and take note of any specific tender points. To increase the pressure even more, you can hold your ankle with your left hand. Find a painful spot on this side and keep applying pressure to it for about 15 seconds. Take calm, deep breaths. If you have any problems supporting yourself, put more of your weight onto the ball. If this is too intense, use a fascia roller instead of the fascia ball first. Roll on it slowly in a circular motion. Put your right leg down again and place the ball under the left buttock. Place your left leg on your right thigh. Move slowly on the spot and take note of any specific tender points in your glutes. Move forward, backward, sideways, or in a circular motion, whatever feels good to you. If you want to increase the pressure, grab your left ankle with your right hand. Look for another area of adhesion. Hold the pressure on this spot for 15 seconds. Don't forget to take a deep breath in and then exhale. Continue to roll. You're almost done. And 5, 4, 3, 2, 1. Slowly come out of the position. Exercise 3. Triggering the lower back. OK, moving on. Use the BLACKROLL Trigger TMX to loosen deep muscle tension. Sitting down, position the BLACKROLL Trigger TMX on the painful spot in your glutes and let yourself sink slowly down onto the trigger. Sink deeper into the ball with each breath. Just relax. The pain should gradually subside. For additional mobilization, start to lift your thighs slightly and put it down again. For optimum treatment, keep applying the pressure for about 3 minutes. Treatment with the trigger tool promotes blood circulation and helps your tissue to regenerate. In order to be able to release tension in the tissue, oxygen-rich blood must reach the cells faster and oxygen-depleted blood must be removed more easily. Hold on a little longer. The countdown has begun. Switch sides by sitting on the trigger with the other half of your buttocks and letting it sink deep into the tissue. You can vary the pressure on the trigger using your arms. Stay in that position. Maintain the pressure on the trigger point on the other side for about 3 minutes. After using the trigger tools, you may experience muscle soreness, slight aggravation of the pain, or bruising. There is no reason to be concerned. These are some of the normal effects of treating a muscle in this way. Only 30 more seconds. Lower and raise your left leg again. Slowly come out of the position. We will now move on to the stretching exercises. Exercise 4. Elongating the front myofascial chains. You need a BLACKROLL super band for this next exercise. Attach the band to an object at waist level. Start on your knees and place the super band around your hips. Hold your lumbar spine with your hands and draw your chin back toward your spine. Stretch your hips forward and slowly lower your body backward. Breathe deeply and try to drop deeper into the position with each exhalation. Compression on one side creates space on the other side of the disc. Old fluid is pushed out of the disc. Now bring your hips back and take a short break. We are going to do the same stretch again. Put your hands back on your lumbar spine. Stretch your hips forward and slowly lower your body backward. If the stretching effect is not enough for you, you can try to hold your ankles with your hands. You should never feel pain during this exercise. Only do this advanced version if you are ready. Slowly come back to the starting position. Exercise 5. Stretching the gluteal muscles. You need a BLACKROLL super band for this stretching exercise. Attach the band to an object at shin level. Place the super band on the inside of your right thigh and position the band close to the hip. Bring one leg in front of your body and bend your knee to between 45 degrees and 90 degrees. Extend your left leg out behind your body and press your pelvis on the side of your extended leg toward the floor. If you are unable to assume this position, place a BLACKROLL under your right knee. This will make the stretch easier for you. To increase the stretch, put your forearms on the floor. If you want to go a little deeper into the stretch, lay your head on the back of your hand. Pulling the band in this position pulls your hip joint into the correct position. It also increases the stretching effect. Switch sides in 5, 4, 3, 2, 1. Position the band around your left thigh. Bring one leg in front of your body and bend your knee to between 45 degrees and 90 degrees. Extend your right leg out behind your body and press your pelvis on the side of your extended leg toward the floor, just as before. To increase the stretch even more, put your forearms on the floor. Take a deep breath in and out. If you can, lay your head on the back of your hand. Okay, you're done. Slowly push yourself out of the position using your arms. Exercise 6. Arm support with arm and leg raises. You will need the BLACKROLL Superband again for this first strengthening exercise. For arm support, place the band around your left foot and hold the other end with your right hand. Get down on all fours. Raise one arm and the opposite leg at the same time. Repeat this 10 times. 5, 6, 7, 8, 9, 10. Take a short break. Now switch sides. Place the band around your right foot and your left hand. Get ready. We're going to start in 3, 2, 1. 2, 3, 4, 5, 6, 7, 8, 9, 10. Take a quick breath and switch to the other side. Be sure not to let your spine sink down too low in the hollow back pose, and make sure you can keep your core engaged. Get ready. It's time for the other side. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Take a quick breath. If you need a longer break between sets, just pause the video. Last round. It's time for the other side again. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Exercise 7. Rolling plank. You need a BLACKROLL fascia roller for this final strengthening exercise. Assume the plank position and place your forearms on a BLACKROLL. Turn your palms to the ceiling and draw your belly button in toward your spine. Make sure you keep your spine straight. If you want, you can further intensify the exercise by rolling forward and backward over your forearms. This exercise is very challenging. Perform the following exercises only when you can do them without experiencing any pain. Time for a short break. This exercise can really make you puff and pant. Take deep breaths. Are you ready for the next round? We're moving on to set 2. Assume the forearm support position on the roller again. Remember to keep your spine straight. If you want, you can roll back and forth again. Just 5 more seconds. 3, 2, 1, and break. Shake out your hands briefly. Relax for a second and recharge your energy. Just one more round. Get into the forearm support position one last time. To increase the intensity, roll back and forth. Otherwise, you will just be staying in a static position. But that can also be quite tiring. Keep your buttocks down. You're almost done. 5, 4, 3, 2, 1. Perform the exercise routine 2 to 3 times a week. We hope you feel better soon. See you next time.